I have three questions. First of all, regarding those 8 pending cases, are these people at home, at hospital, waiting for the testing results coming back?
Yes, so, is that one person presented?
You should repeat the question.
Yes, sorry. So the question was, for the 8 individuals who are pending testing results, where are they at? Are they at home? Are they at a hospital? If the person was ill enough to be admitted to the hospital, they have remained at the hospital. If the person was not ill enough to be admitted to the hospital or saw their primary care provider to seek that testing, they were allowed to go home and with instructions to stay home and isolate themselves from their family members until the testing results come back.
If in case they are tested positive, is there any way you can tell how many people they have in close contact?
Yes. So that's where that 6-foot rule comes in really handy, where anyone who's, we will interview the case as well as their family members and say, have you been within 6 feet of them and they've not had a mask on and have been coughing, sneezing, and from there we will build our list of contacts. Most likely family members, but it may also include coworkers too, if they are in close proximity to coworkers for extended periods of time. So we do work very hard to try to trace down every contact that an ill person does have, and it's a routine practice as part of public health.
Okay. Should I ask 2 more so we can give you a chance?
We actually have slides that address some of the other questions that were given to us, so could we go through those first?
Okay.
So we have this question. Is the Department of Health and Human Services and Centers of Disease Control and Prevention different organizations? So that answer is no. They are actually the same. The Department of Health and Human Services is the department that houses the Center of Communicable Disease and Prevention. So it is an agency underneath that department. So the messaging is actually the same, coming from DHHS and CDC. So that was one of the questions. So then what is our protocol for deciding who and how to test for COVID-19? So I think Nicole kind of touched on this with her answer, but basically, if a healthcare provider suspects someone who is ill and may be infected with COVID-19, they are asked to contact either the state or local health department and discuss exactly what they believe is the possible diagnosis. We ask them to do screening, so they ask questions about travel. They ask for what their clinical symptoms are. They also ask if they've been in contact with anyone that may have been also sick with a respiratory illness. So we try to cover all the bases of how we think that the disease might have been transmitted to them. So that's the reasoning behind why they would want to get the testing done as well. If we feel they meet that criteria, then they're classified as what's called a person under investigation. This does not mean they have the disease. This just means that they have enough of the criteria that makes it seem like they could possibly be someone infected, but that doesn't mean that they are. And then once the state and local health department decide to then approve that testing, then our public health lab, which is able to do the testing for COVID-19, will accept the specimen for testing. So basically, these days, mostly the laboratories that accept and can test for COVID-19 at present are public health state labs. So that's why we have this approval process in place. Because we,
Sorry, I have a follow-up question on this one.
yeah.
So is there any limitation on how many cases you can submit for testing?
I'm glad you asked that question. So we are also in the process of helping other laboratories validate their testing process. So we do know that there are some academic institutions as well as hospitals that want to be able to test for COVID-19 as well. And so part of the process is they have to validate and make sure that these tests are going to work in their own system. They're developing their own tests. So they actually have to send their specimens to the state health laboratory first to make sure their testing works. And then they're going to be allowed to actually run tests in-house. We also know of commercial laboratories that have also applied for permission to actually do this type of testing as well. And I believe some of them are probably going to come online early next week. And some of them are national laboratories. And they are definitely Michigan hospitals and providers that send their tests to get them tested at that national laboratory. But that's not in place yet. So for now, it's just the public health labs. But that once that capacity increases, then it's not, this criteria and this approval process will be less stringent, and people can actually just order the testing from a commercial laboratory.
So sorry,
Yeah.
follow up on that. So do we have any cases, like we have cases that cannot be tested yet?
Just because limitation of the testing kits or capabilities.
Go ahead.
As of
There's
right
a, I would call it misinformation at this point. I want to clarify because there's information spreading on the social media saying there's not enough, capability at Michigan to test all those possible cases and raise a lot of concerns. I hope those are misinformation.
Yes, they are misinformation. So as you saw, we have only approved 16 individuals to be tested so far because they meet that criteria. Yesterday at the HHS released a press release talking about how we had received an additional test kit and have the ability to test up to 300. And as Joyce mentioned, we are going to be using some of that 300 to validate other laboratories that are trying to develop their own test. But the good news is as we go through and validate more laboratories to do this testing, we increase our capacity to do so. At this time, we have not exceeded our capacity because we are still using that criteria to make sure that tests are used on individuals who do have a risk for having COVID-19, as well as signs and symptoms consistent with that. So we are working very hard to try to make sure we are testing the people who truly need it.
Thank you.
Yep.
So we also got questions about, is this test free and who would cover the test costs, and whether the federal government has funding to cover the cost of testing. So everything that is actually submitted to our state public health lab, those tests are free. What the cost may come down to is whether or not you have, as an individual, when you make an appointment with your primary care provider or you go through an ED, you might get charged for going to get that visit to then collect that specimen that gets submitted to the public health lab. We mentioned that possibly private and commercial laboratories as well as hospital systems will also start being able to test, and those tests will probably incur some costs, and hopefully your insurance would be able to cover it. But in that case, the third point is that I think the federal government is trying to assure and make sure that there is funding to test no matter what person's insurance status is and what their capabilities are for paying. So that's the application that's being pushed through Congress right now. So we got another question about, are there any negative pressure ICU rooms available in the Metro Detroit area, and are there ECMO machines available? So negative pressure ICU rooms are generally used to help isolate people with potential respiratory illness that we don't want spreading to other people. In the past, they've been used for tuberculosis. That's where they would put someone who's also infectious with measles. These are things that are very easily transmitted through the respiratory route. And then the ECMO machines are extracorporeal, membrane osmosis machines. These are machines that are used to sustain people who are very ill and aren't able to circulate blood through their body by themselves. So they are hooked up to this machine to provide assistance for that function. We actually do have several large hospitals in the area that have negative pressure rooms. I honestly do not know the quantity per hospital, but they are mainly, most of the large hospitals do at least have one negative pressure room. For the ECMO machines, they are also based out of more likely larger hospital systems and also hospitals that specialize in pediatric care. This machine was first used in the pediatric population. So that is mainly the hospitals that would have these machines available, in especially Southeast Michigan. And if they didn't have it and they required the use of this machine, they would then transport the patient from the facility that they're at to the facility where the ECMO machine is available. And that has been done in the past. So, and then do we need to prepare stockpiles of food or other household items? I don't know, has anybody been to Costco recently? So we do ask people to try to create a household plan of action. This is something we, in public health preparedness, have been touting all along. This has just become a more sharp focus now that we actually have an event where we are responding this way. So we want to make sure that you talk to people in your household, your family members and close friends, to make sure that you have ways of caring for each other in case someone is needing to home isolate or not be able to go out to get supplies and food, and to try to maybe get to know your neighbors to see if there's a way that you could help each other in times like this. And also maybe identify aid organizations in your community. So if you did have to access those supplies that are not available, that you have someplace else to turn to. And then also create your own emergency contact list. You know, we always have to have an emergency contact with someone when you go in for a medical procedure. You want to create some kind of similar list of people that you would want to contact in case you were not able to do certain things in the community. We also always encourage people to practice good health habits. And like Nicole had mentioned earlier, when you self-isolate, you want to make sure in your own home you have a room you can isolate yourself in, just in case you may be infected and you don't want it to spread to other close members of your family and other friends that may come to visit your home. And then think about what would happen if your child's school or daycare was closed. This is definitely happening in Washington State, where they're starting to close schools because they do have limited community spread. So this is something you may need to think ahead of time what to do just in case this happened in your own household. And then also think about what would happen if you had to stay home from work or other changes that might happen in your own workplace. And we know that there are businesses looking into these kind of temporary plans as well. So that's it. I can take any extra questions, and Nicole too.
Good afternoon. I have 3 questions. One, when you talked about the 8 people who are already tested and tested negative, and the 8 people who are pending, did you say whether or not these people had traveled outside of the U.S., or did we think this was a community spread? That's question number 1.
So we are still utilizing travel criteria within the prior 14 days to either a level 2 or level 3 country as part of our testing requirements. For individuals who have no travel at all, we have been asking that a respiratory panel be conducted before we approve those individuals for testing, so that we can see if they have possibly another more common respiratory cause as to why they're currently sick. But for the full 8 that are pending, I cannot speak to as to whether or not they have that travel criteria or if they have no travel.
The second question, for the state emergency preparedness area, how closely are you working with local health departments to disseminate information to the populace, particularly in racial ethnic populations?
So meetings like this one today are good first steps that we at MDHHS have been trying to implement. As far as working with the local health departments, what we didn't mention is that we actually have weekly calls with the local health department, and there's one actually happening right now, where we speak with our local health department partners to try to address some of the questions and some of the concerns that they're having from the calls that they're receiving from the general public. They in turn also work through their emergency preparedness coordinators stationed at the local health departments to try to reach out to community partners, religious groups, things along those lines that they already have existing, to try to work with them to develop preparedness plans. So that kind of happens more at the local health department level. We provide them with information and resources that they can share with those communities. But unless requested, we don't directly do that.
This meeting was created from my section
Right.
of disparity section.
Mm-hmm.
So I was asking particularly about the local health departments. And finally, an uncomfortable question. Can we trust the CDC? Based on the president saying that it was a hoax? and thinking about information that may or may not be disseminated to the public?
The CDC has been conducting calls ever since January 2020. They have been having weekly calls with the state health departments. They've been having media calls on a regular basis. So, and the CDC, most of the staff have some kind of scientific-based degree. A lot of them are MDs, many are PhDs, many of them are Masters of Public Health. So in order to do, and same with Nicole and myself, so in order to do our jobs, we base a lot of our information on what is proven, what is more based on actual studies and science. So I do think we can trust the CDC. They're the ones that are on the front lines a lot of times for many of these emerging infections, gathering information, making sure we have a full picture of what's going on before we start to disseminate that information. So I think they've been trying to be as transparent as possible during the process. And I can tell you during some of these calls, if they don't know something, they will say, I don't know, I will look into it, or I will refer to our experts. So they are very transparent when they talk to us about what is going on. So yes, I would trust the CDC.
I will, just to add what Joyce said, is the CDC has also posted transcripts of every call that they've had with media partners. Those are made available, as well as audio transcripts. The frequencies of the calls have not changed since Vice President Pence was appointed to be in charge of the nation's COVID-19 response. And our CDC partners are working very, very hard to try to make sure that information is disseminated quickly, which is why a lot of things change a lot. We've probably had, this is our 4th version of the persons under investigation criteria that we've had to try to, so CDC's been trying to expand that criteria to make sure that we are capturing as accurately individuals who have exposure and risk to be tested. So they have been very quick in that response.
I have a question from an online viewer. They want advice for those who are planning large-scale events, indoor and outdoor.
We actually have guidance for that on the CDC website. There, on the CDC COVID-19 page, there's information for individuals who are planning large gatherings. So if you go to the COVID-19 page, and I believe it's under the what's new right now because it was posted, I think, 3 days ago. That information is posted there, kind of talks about what steps event planners should take to ensure that if an individual does become ill with COVID-19 like symptoms, that you can isolate them away, get them medical care, and make sure that everybody else has a safe and healthy event. So they talk about things such as having hand hygiene stations, hand sanitizer posted around event areas so that people can utilize them as part of that guidance.
Another question from the online viewer. Will virus subside with warmer temperature, warmer weather?
We'll see. As with most respiratory viruses, they tend to decline over the summer months where we get to go outside and not be together in close quarters indoors in cold weather like we are. So typically that kind of halts the transmission of respiratory illnesses over the summer because we just are generally outside, out and about, not as much indoors as much. So we'll see, fingers crossed.
I got a couple questions. One is regarding the isolation of the possible patients in our own home. And the lesson we learned from Wuhan is when the people were sent to their home, if they do have the virus, they tend to actually infect the whole household. And here in Michigan, our house is kind of connected through the central air conditioning system and heating. I didn't see, I would recommend, maybe I'm not an expert of course, but from common sense, would there be a recommendation that when those people are isolated in a household, they should shut down their air duct in a room and use space heaters instead to avoid those kind of within the family's transmission?
So within the home isolation guidance that CDC has put forth, they don't recommend shutting down of air ducts or things such as that. They recommend just the isolation of the individual to their own separate room by which they can be in there, and that if family members do go into that room, that they, the person who is ill dons a mask, as well as the family members going in there. But we also did do a study out of Seattle for monitoring of their initial active cases. And what they found is that family members actually, in close contacts of individual cases, did not get as sick as we would have thought, seeing the data coming out of China.
But there was a case in New York City that had that.
Correct. And I can't speak to whether or not that individual appropriately self-isolated at home, whether or not they were using appropriate PPE once they did become sick. So that I can't speak to what that individual person did, but we at CDC and study of individuals who did follow those appropriate recommendations, those individuals did not get sick. There's actually, that study is actually profiled in a morbidity and mortality weekly report article that is released this week. So that is also posted on the CDC's website as well if you'd like to look at it.
Okay, thank you. My second question is regarding the quarantine of the people traveling in those countries that are high risk: China, South Korea, Japan, and Italy. I understand people from Italy and South Korea probably put in or voluntary quarantine even without symptoms, right? But I see there's no indication. I mean, from the slide I've seen, it's only when they show some symptoms they should report and do quarantines. Because I know in Novi, I had one tenant that just recently traveled back to Japan and came back last week. I don't think they were advised to actually self-quarantine for 14 days. Considering the disease can transmit without any symptom, that's a concern. And my question is that should our state be more aggressive, considering especially we have a large international air hub in Detroit?
So, for individuals returning from Japan and Italy, they are not made to do that public health supervised monitoring over the 14 days after they return. What we have been told by CDC is that they are giving these individuals information about the illness and to watch for signs and symptoms. These individuals can choose to call the local health department and ask for supervision during their monitoring period. And the health departments are happy to assist them in that process.
So the other thing that what we do when someone self-reports to the local health department and they agree to self-home isolate and be monitored for their symptoms. So essentially they're contacted on a daily basis to see if they have become symptomatic at all, whether or not they have a fever, and they actually give us the fever measurement, the temperature measurement, of themselves. And after the 14-day period is over, the local health department can give them a letter so that they can give to their employer to let them know that they were actually not able to work in the workplace or something like that as a result of isolating themselves at home. So we do have that availability. It's not something we push out because normally when someone is symptomatic, that's when we're mostly seeing those cases being transmitted. We cannot say for sure that someone asymptomatic cannot spread it, but if they're that concerned as a citizen, they are encouraged to contact their health department and get additional guidance and have this additional support in case this is something they decide to do themselves.
So you're saying they voluntarily they can report for monitoring?
Yes.
Yes, they can.
But are they informed of that process upon the entry of the port?
Yes, based on what we've been told by the CDC quarantine station, yes. Second part of that question regarding the asymptomatic spread. As of right now, CDC still is standing by that droplet spread is the primary process by which an individual will transmit to other persons. And this is primarily when they are symptomatic, coughing, sneezing, have a fever, when they will transmit to others. As of right now, that's what we know in terms of how this is spread. We do not feel feel that this is being spread asymptomatically.
And you still do all the health practices, you know, you can still clean all your surfaces frequently. You can still do hand hygiene on a regular basis, you know, just after you use, before you eat, after you use the bathroom, all these types of practices. These are practices you should incorporate in your daily life. And they will definitely help cut down the chance of transmission of any kind of respiratory virus, not just COVID-19.
Yeah, I just want to share the concern from the community that we feel like CDC and the health department are not aggressive enough to attack this, because this disease is not something we have seen before like SARS. It's asymptomatic transmission and incubation. Especially we heard that in California, right, the cases that people have
No apparent transmission path at all. That really concerned us as a public, that we just hope that even CDC may not give recommendations. We hope that the state can be more aggressive in that regard.
So we depend on what's called local epidemiology. So we base it on what disease we are seeing and experiencing in the state itself. So the disease of most concern at present in Michigan is actually influenza. We are seeing a high activity of influenza in general in the state, including Southeast Michigan. So we do encourage people to do a lot of these practices that would prevent COVID spread, just because influenza is also in the community.
I have several questions. I will start with the easiest one. Is your presentation available online?
It's to be posted, correct?
Yes.
Okay.
Or is the website or?
yeah.
Okay, thank you.
We have done, yeah.
Okay, you mentioned that you have been doing preparedness training ever since H1N1, for example. How do we get more information about the process from the CDC website?
So there are CDC templates available on the website that they have, and a lot of the states and local health departments have been using that as kind of the backbone of their plans. And then the specifics are when you have a local health department, they have business partners or they have school partners. You know, they've already tried to talk through some of these situations with them. So each local health department has their own specific plan based on their own locality. So you would probably be best to contact your local health department and see if that's something that you can have access to, or have them come present to you and give you more information specific to your own, you know, your own jurisdiction.
Okay, thank you. And have you ever thought about the worst nightmare scenario? I mean, based on the information I've heard right now, actually, I concern more about the preparedness, to be honest with you. We've seen bad examples from New York, from Seattle. People come in to the nursing home, fire stations, half of them have to stay at home now because they just go there without any proper protection on themselves, firefighters. New York, this lawyer from Manhattan, he infected his family members. He asked a favor from his neighbor to pick him up to go to the hospital. Now his neighbor got infected, and 3 of his kids. I guess I have no answer. I don't expect the answer from you right now, but just I want to voice the concern from my communities. The other thing is, going back to the CDC guideline, I understand all the doctors here practice medical here in the United States have to go under CDC guidelines. But in China, they have accumulated 80,000 battle experience. They're on the front line right now. And then they have published the updated version number 7 now, how to treat patients from mild symptoms to the severe symptoms. To my surprise, there's not even an English version of that. So my coalitions, my Chinese Americans, coalitions to fight COVID-19, we have organized our members ourselves to translate the national guideline, how to treat those COVID-19 patients. I would be more than happy to share with you, with the CDC, with the state. Okay, I understand all the doctors I have been asking for my primary physician. He said, yeah, but we have to practice on the CDC guideline. I said, fine. For example, if you play the games, basketball games, 80,000 times, I'm telling you, I don't care about your experience. I mean, 80,000 games already. I have to listen to my coach, my guideline. It just doesn't make any sense to me. So I hope CDC, local medical professional, can at least use that as a reference. And again, going back to this preparedness thing, ever since we had this big blackout, when I was at a Ford Motor Company, 2005, 2006, we are having fire drill, blackout drill every year. So I cannot imagine for a crisis like this, we don't have elective drill that is statewide to practice. What about if we have 50 people or 500 people getting infected? How many ambulances? How many ICUs? How many medical professionals? We have to be grouped together in short time. You have to think about it. I totally get it. You have to watch the scenario go day by day. But look at France. French president just announced, okay, this disease is unstoppable. Look at Italy, it's out of control. So China is different. China has different political system. I understand that, but I guess as a state, Michigan is immune from all these positive cases at this moment. But we have to think about the worst nightmare scenario.
Just to add to that, I know I mentioned that there are regional healthcare coalitions within the state. We have 8 across the state. If you are interested in participating in those regional healthcare coalitions, because you do have valid concerns and are working very hard to try to get more information out there, I would encourage you to also reach out to the regional healthcare coalitions to participate in the planning activities.
Here's one more barrier. I would say more than half of my Chinese American communities, they don't speak English, or they barely speak English. Or even the people like me that are actually in the US, I know basic about medical terminologies. When I walk into the hospital, I'm not comfortable asking about specific ICU, negative pressure. I don't understand. I got my master's degree here. I know probably even below 101, medical 101 knowledge. So imagine a Chinese citizen, American citizen here, he barely speaks English. He has no idea which hotline to call. He would just probably drive himself up to the ER room. That's just, the language barrier is my coalition. It's one of our goals to help those people get educated or offer bilingual translation services. That's just my concern. Thank you.
So I know that we have some basic documents that are posted on our websites that are in both traditional and simplified Chinese. We do try to make them understand that there are differences even within the Chinese community of how things are communicated out. I think, unfortunately, this is a very fast-moving situation where all the information we have changes almost on a daily basis. So, you know, the information you have about the New York citizen who is probably spreading to their family, I mean, we only just heard of it ourselves, and we don't honestly know the details of how that happened. And until we have a better base of knowledge of all those different types of scenarios and situations, like you mentioned that they already have experience in China, then it's hard for us to take that into account. But I think they are trying to examine those documents. I don't know at the state level how well that's being translated, because I don't think they have a lot of that experience. But I know nationally they have been trying to look into that, so.
Yeah, I think I share the concern is, as I mentioned earlier, is this disease is never seen before the way the behavior was. That's why it's out of control in China. It kills so many people. And here it just won't allow us to be, you know, complacent, and I just hope that the government can be more aggressive.
No, the effort for the repatriation was unheard of. That's something we've never done in the U.S., right?
Absolutely.
Taking those people from China, just immediately putting them into quarantine, not letting them go home at all, and self-isolate. That is something that has not been done before.
Absolutely.
So that's part of the aggressive action that they were trying to implement to slow the spread, because we knew that even though we didn't have that many cases at the time, that it was inevitable, unfortunately, to have a few cases show up in the American population. So that was part of the initial push. I understand, you know, in Michigan it may seem like we're complacent, but I'm letting you know that we have been asking of the local health departments and the local healthcare coalitions. They're being surveyed about how much they have of certain equipment, how much do they have of certain capacity, what would they do to set up an alternate care site. These are all things that have been constantly talked about over the years, and they're just bringing it back into focus because of what's happening now.
Right, but for example, I was a little shocked, to be honest with you, when I heard that CDC is not recognizing the, asymptomatic transmission, because that's widely reported in media. I don't understand why that's not recognized by the CDC and take any measures against it, because that's the most, stealth way of transmission for this virus. That's why it's so dangerous.
We have a question from a viewer. Should people who has flu-like sickness or symptoms, but without travel history to do the test, such as especially for healthcare workers, they have flu-like symptoms or sickness, but they do not have travel history. Do you recommend a test for this kind of person?
If they have no travel history outside of the state of Michigan, given that we currently do not have any cases, we would recommend that they actually do what's called a respiratory panel test. And that would cover common respiratory illnesses like influenza, and have that test done first. If that test turns out to be negative for that wide variety of common respiratory viruses, then we would recommend that they go through testing and receive testing through the state lab.
And they talk to their doctors, right?
Yes, they would go to their doctor for that.
All right.
Yeah.
And that's what we're going to say. I think that person should go to the physician, have physician make the suggestion.
Yes, absolutely. Yeah. Sorry, kind of skipped over that step by saying just go and get a respiratory panel test.
I just have a question. This might touch upon earlier, because Detroit has a lot of international traveling. So where is the updated information? Obviously, before it's only China. Now we hear more countries added to either level 2 or level 3. Mm-hmm. And even domestically, even no place has declared, but we heard a lot about Washington State, California and all that. So where can people get sort of updated information regarding to know where the travel, related? And also I think it's good recommendation, because we don't know all the country added could be in the future. Is that good policy to let people know when they do some international travel, maybe they should stay home for 14 days? It's a good prevention. So those type of things is not really a cause of fear. It's really actions we take to prevent really will save a lot more in large. So things like that, I don't know where we could share that type of information or promote good action, preventative.
Yeah, so there's a site that we use often for people who plan to travel internationally. It's called, from CDC, it's www.cdc.gov/travel. And within that site, you can actually type the country that you intend to go to, and it will give you a list of information about what you should do to prepare to go to that country. Do you need to get your vaccinations brought up to date? Do you need to take any precautions in terms of food or water while you're in that country? On that site, they've also concurrently posted those level 2, 3, and 1 countries for COVID-19 concerns. So that information is also listed there, and that will be where it's posted most up to date.
I would say, when you take the flight, you make air ticket reservation, right? I took the information from the airline, like Delta, for example. I had the trip scheduled to Paris back in December, and I had to cancel the trip because the strike. And I got the information from the airline online.
Okay.
And I was able to get it canceled. So I think that's starting from there. And also in regards to level 2, level 3, I think when the traveler coming through those countries into the States, an immigration office can give them the instruction, you stay at home. If you are coming from level 3, stay home for 2 weeks. Not just suggesting, we suggest you monitor your temperature, whatever. Tell them exactly you stay at home for 2 weeks.
Yeah, for those countries where we are referring individuals for monitoring, they are given those strict instructions to stay home. Mm-hmm. With public health assistance, they're going through the 14 days of monitoring where they're being checked on every day in terms of temperature and symptoms. So currently that is China and Iran. But for those other countries, they are given information about signs and symptoms to watch for the next 14 days. those individuals can choose to stay home if they want to. But currently, based on the guidance that is put forth, there's nothing in terms of travel or whether or not they can move out. They're still classified as low risk.
As a nurse by training, I really like taking proactive actions, just like several leaders here. So I think for us, we have a role in our community. So we learn information from today. So I really hope and want to encourage everyone that, find a way that you could disseminate this information, including that, it's not mandatory. We cannot, in this country, we cannot do lockdown like Wuhan. But we could inform our community how to take a proactive role to protect everybody around you, right? And so I really hope that this is coming out of, that's why so many of you are here, because I hope that each one of us takes some responsibility when we go home today. And maybe that will become a ripple effect. And so like I said, media is very powerful. So I'm going to share with my media friends in my India.com's Star newspaper for Filipino community. So anything, please, anything you could do. Lisa, you have your media channel, and then we have radio show. So please, send the information to any of your friends who have power to make an impact in the community.
Really quick, can I say something? I think what I want to anchor what everybody said. Okay, in particular, Gary and Joe. I think the problems right now, people entering the country, is too loose. I have a friend. It's literally, she came from. I don't think I need them. I'm very loud. And she's came from. China to Germany and traveling. And she said she entering this country in Detroit. Nobody asked any questions. So that's the problem. How are we gonna,
When was her
is there any?
travel?
That was a few days ago.
Okay.
Even now, you say still probably.
I mean, when did he go to those countries, like China?
No, eight.
Recently? I think it depends on the time.
1 week ago.
So, it depends on when she was in China proper.
She didn't come directly from a different country.
Right,
But-
right.
Quick question, I want to make sure we get that straight. So China, right, specific days. Do we have a system in place that all,
It's for viewer.
Yep. Do we have a system in place, like for everyone that's coming in from China, whatever your origin is, right? They're already red flagged before they walk in. There's a computer system or just a system specifically for that, because.
Not necessarily
Not
China,
necessarily,
Korea,
but anyway,
Japan
right.
now.
So do they flag these folks that are coming in? Maybe they didn't come from Italy, but they were from Italy. They went and maybe went to Guam somewhere and then flew here. Is there a system to check? That's through the passport system, right? When they enter, are the agents like informed? Wait a second, there might be a potential connection that you were in these places. They're in level 1, level 2. Do they have that in? That's why I'm concerned. Do they have that in place right now?
Yes.
Okay.
So that's how we've been identifying individuals for that 14 days of public health monitoring travel. And regarding the scenario where the individual was in China, went to other countries, and then came back, those are called broken chains of broken travel by our quarantine station folks. So what they do when they come through customs, if they have China travel history, they will check to see if they had that travel within the past 14 days. So if the travel to China was greater than 14 days ago, that individual will not be referred to the local health department for monitoring because it's been greater than 14 days since they were in China. So they wouldn't have that referral to the local health department for monitoring because they exceeded their 14 days. Does that make sense?
Yeah, I know I have a friend, I just picked up a friend from airport. She came back from Taiwan. I think she came in through San Francisco airport. The immigration officer just asked him, have you been to China, Japan? She said yes. The immigration officer, the eyes are wide open. When did you go? And she said, well, in December. And then she said, you're fine, let it.
Exactly.
Oh.
So it depends on what. They look at passport, this check.
It's not there's a system.
Yeah, yeah. So our quarantine station staff have implemented that, and actually quite a few of the individuals who got referred to initially were individuals who had been in China months ago. When our local health departments reached out and contacted those individuals, they're like, oh, well, I was in China back in December, but I just came back from South America last week. So, and that's when the date of referral was the week prior. So we initially, we kind of refined our process to be more strict about was that travel from China within the last 14 days, and those individuals are being referred to the local health departments for follow-up.
Right, and it came in on January 29th and through Detroit. So I was asked, where else you go? You went? I said Japan for a day. Okay.
Yep.
And you don't feel like countries like from like the other ones that are being banned now, like South Korea and Italy, are they gonna also implement these travel? Very soon. If you're saying Italy, Japan, right? You're saying
Yes, Japan, Korea.
And
South
Korea,
Korea.
but
South
Italy's
Korea,
having issues, right? Correct me if I'm wrong. Let's
You're
just
not
be
wrong.
Okay. So
As far as we know, to sorry to interrupt you, or know right now,
nothing yet.
France and the UK got hundreds of
Yeah.
new confirmed cases daily now.
UK?
Yes.
Wow.
So what I'm
Europe.
saying is that
It's global.
at this
Europe.
point, I mean, for the United States, the best thing to do is to build a wall. Make sure you that's
Like
not what
Wuhan?
we're here. It's really just prevent those come in. That's really we are concerned about.
Do the lockout.
I think isolation is really the key.
I think
It's
some of the
really-
nightmare reaction, or maybe is down the road, if the next week or so, if it just explodes here, I mean, you just can't put everybody in. It's scary. That's all.
Yeah, and so that's why we kind of touch on those good personal health prevention measures. Make sure that you yourself are washing your hands frequently, have a plan in place so that if your school, work, general life activities are disrupted, you can make sure that you yourself are safe and prevent others from becoming ill if you do become sick. So we realize that this likely will have further spread. We're not saying that's not a possibility, but we want to make sure that individuals are able to be prepared for this in the event that, it does become more widespread across the country as well within the state, that, you have those good personal health tools in place to try to prevent yourself from getting sick.
Okay, just a few days ago, I got a call from my son when he was at work, and he told me that, Mom, I'm going to Boston this weekend. I'm going to fly to Boston to pick up a car that he bought. And then, of course, he got yelled at. What I'm trying to say is that the level of alert and awareness are very different. And I'll have to say that we as Chinese, we have a higher standard in this case, in fighting this disease. So we're hoping that whatever we said here, the comments, can be brought back to the department. And then before we can fight this disease successfully, we just have to keep on telling people what to do and then keep on telling you what our concerns are.
Yes, absolutely.
And I'm one of the fortunate one that I have never experienced a war, but to me, this is a war. It is. And then, so one thing is important, that you always want to understand your enemy, and you do whatever you can, you work together to fight the disease, to fight the virus. Dr. Wu, you have any closing remarks?
Again, thank you, minority section, Jakarta Hinton. She's from that section with Brenda. And thank you to wonderful epidemiologists. Keep us, informed and hear our concerns. And certainly that we are really passionate. And the reason is we want to protect our family. And that's why there are so many voices out there. And we, as a whole, like Shirley said, this is a war, but we want to get ready and to be on the top of it. And thank you all, the leader from various communities coming from your busy time of the day, and we hope that we could do this in a very well prepared way. Thank you.
爸，你会填2020年人口普查吗？
人口普查？
对呀，每10年一次，重新统计住在美国的每个人，这些数据有助规划公共资金，决定分给学校、诊所、收入等的比例。学校教的。
真好，但是爸爸现在没时间。
爸，很重要，我们一起上2020census.gov， 说不定还能改善交通呢。
那爸感兴趣。
详情请上2020census.gov。